Hi, good night, and welcome to a special edition of CBC Presents as we celebrate World Obesity Day 2022. The theme this year is Everybody Must Act. You must act, I must act, we all need to act. And we have a very, very special lineup tonight. My name is Taahir Bulbulia, and join with me as we take a journey into everything health, nutrition, and transformation. We have a special lineup with us. We have Miss Nicole Griffith, who is a public health nutritionist, Dr. Khatija Mangera, who is a family physician, Miss Shereika Mills, all the way from Jamaica, Kingston, Jamaica, Policy and Advocacy Coordinator for the Jamaica Youth Advocacy Network, and last but by no means least, Mr. Raphael Saul, the Assistant Director for the National Transformation Initiative with responsibility for strategic partnerships, best and the implementation. So ladies and gentlemen, fasten your seatbelts. It's going to be exciting, it's going to be a vibe, and it's going to be lots of energy as we discuss all things health. But throughout the show, we want to hear from you, the public, and you're going to have your chance to call in. And you can also send your WhatsApp messages to 228-5562 or 228-5563. Also, we have a surprising poll for you that you can take, and we want everyone to take it and share your opinion. Text the word ACT to 832-6775. So ladies and gentlemen, fasten your seatbelts. We're going to take a short commercial break, and we'll be right back. Hello and welcome back to the special edition of CBC Presents as we commemorate World Obesity Day 2022. So let's jump right into the discussion. We're going to go to Nicole Griffith, who is a public health nutritionist. And Nicole, we know that 1 in 3 children are overweight or obese. 80% of our deaths in Barbados are associated with non-communicable diseases, and government spends millions of dollars on fighting this public health crisis that we have. Paint the image. Give the public some knowledge on the actual crisis we have. And I'm not talking about COVID-19, but the health crisis in the fight against non-communicable diseases and obesity in Barbados.
So as it relates to the NCD pandemic, which has been going on for a very long time, way before COVID, as you was said, Taahir, we have some who have are coming very early with non-communicable disease and showing signs. You have we have kids who are now showing signs of obesity from very, very young. And we have gone where once a nation that under nutrition had nutrition are at a stage where we have open nutrition, where we have persons who have obesity, who are having situations where things that you would have seen 65 and 70 years old, things that you would have expected from your grandparents, you are now seeing in kids as little as 5 years old. You have children who are having episodes of hypertension. They're having episodes of diabetes from very early ages. You have children who are experiencing overweight from way young, as from years old, children super obese, and all because of the food that we live in, and the food that we live in for the last couple of years is totally different food environment we were accustomed to many years ago. And this is one of the reasons why we need policy. But is a hope that we can have policy that would help guide us as a nation and help us guide our school age to be able to have acceptable foods that they can possibly have to eat, instead of them having to choose from a wide variety of things that may not be acceptable for them at this particular age.
Thank you, Nicole. And you really hit the nail on its head there, that a lot of our children are facing these issues from a young age. And as you see, the difference in age has changed. But moving on now, we want to deal solutions. And we're going to bring in Dr. Khatija Mangera, who's a family physician at this time. Dr. Khatija, you know of the issues that we face, and Nicole painted the picture so eloquently. But what practices can families put in place? And especially now that the kids are back out at school, in terms of packing lunches, what practices can families put in place to be more conscious of healthy living and healthy lifestyles?
Hi, good night, everyone. Thanks for having me on the show. Getting to answering your question, a lot of the time as parents and families, we actually have a lot of information already. We know what we need to do. More fruits, more vegetables, less sugar, less salt. But the issue comes up when we're trying to implement all these changes. It can be very overwhelming. And that's also partly because the environment that we live in is not very supportive of making strides towards healthy living. Parents really shouldn't beat themselves up too much. And what I would suggest is taking baby steps and then incrementally increasing once you're able to master each step at a time. So one easy thing that's cost-free is to cut back on what we call sugar-sweetened beverages. And those aren't just carbonated beverages. Those are things like boxed juices and juices in general, which can have just as much sugar or even more sugar than just a normal soft drink. Sometimes up to 9 teaspoons of sugar in a juice alone. And the thing is that these juices contribute not only to obesity, but they have other long-term problems like tooth decay, diabetes, heart problems, and other things that we can't even begin to think about. And the benefit of it is that in the end you actually save money. So it might just be a few dollars a day, but over time that saving can then be used to buy like alternative, healthier products, apples, bananas, vegetables, instead of just sugar-sweetened beverages on a day-to-day. The other thing that I would say is adults need to model the behavior that we need to see in kids, and we shouldn't just target children alone. Families should embrace those changes that they choose to make and do it as a unit, and you're more likely to get success that way. And the other simple step you can do is try to cut back on things like processed foods, packaged foods, things like cookies, cakes, ramen. Those things that are very high in salt and fats and sugars that really don't add any benefit to our diet at all. And the last thing I would say is, as parents, we definitely need to lobby for our children, putting pressure on governments to make policies and implement policies that create that supportive environment. So, in other islands, sugar-sweetened beverages are banned in schools. But yeah, in Barbados, we have easy access to those kind of drinks. So definitely we need to be advocates for change, along with implementing changes in our own families on a day-to-day. And the last thing I was saying is preparation of meals beforehand. So, just cutting up vegetables on the weekend before, marinating meats before, that can actually make it easier during the week to get things together quickly instead of just trying to find the easiest solution out.
Thank you, Khatija. You could not have put it any better. And families must come back to the unit that we have been built on. We often say Barbados has been built on the community and as a family, but we really need to get back to that. I'll go over now to Raphael, Saul. You do some excellent work with the National Transformation Initiative. And it's very important for transformation. And we heard the president's speech at the first sitting of Parliament. And the buzzword in the speech was transformation. But transformation cannot take place without good health. I think, so we have to get into that health. Why is health so important? And why is health so important for transformation to take place, Raphael?
Thanks so much for your question, Taahir. Let me say good evening to you and to the entire panel. It really is an honor for me, on behalf of the National Transformation Initiative, to spend some time addressing what I believe to be a very important cause and issue. You hit the nail on the head, Taahir, when you said that all of our efforts, all of our plans and programs to realize national transformation in a holistic way would be shot in the foot. We pull the carpet from under ourselves if we fail to address what really has been a pandemic that has been sweeping across our country now for some time. At the NTI, the National Transformation Initiative, we're all about retooling, empowering, retraining and enfranchising Barbadians across all sectors and in every space, whether it be the public or private sector, the informal sector, and across industries, tourism, technology. All of these provide opportunities for Barbadians to upskill and improve themselves. But here's the thing, Taahir, as we've been saying, it's amazing to have the opportunity to improve yourself and to make a more meaningful contribution towards society as a whole, to make a great contribution towards national development. But all of these efforts will be short-circuited, Taahir, if we do not address the white elephant, the red herring in the room. And that is, we'll provide opportunities for persons to upskill and improve themselves and to drive the country forward, and not have a population that is in sufficiently good health to capitalize on any of those opportunities. It will reduce life expectancy, which reduces the ability of persons to work and to make contributions towards improving themselves and their families, and contributing towards the improvement of our country. And so the discussion on improving our nationhood, our sense of citizenship, and the degree to which we are able to be contributing members of society must include, I want to underscore that, it must include a discussion on how seriously we are taking health and wellness as a people. The statements that were made by Nicole a bit earlier were quite jarring. When you have children now exhibiting health issues that historically you would have been accustomed seeing from persons in their 50s or 60s, and now we have children as young as 5 years old experiencing some of these health issues. The alarm bells need to be sounded here, so that we realize that what we're facing is potentially not having the workforce, not having the persons actively involved in our community, not having the teachers and engineers and entrepreneurs, not having the people who are so vital to the survival and continuity of our society, because this health crisis is secretly undermining all of our efforts. And so if we talk national transformation, Taahir, we must include, it must be up there as one of the pillars of our discussions, our active involvement, health, and ensuring that we're putting priority on health and wellness across our country.
Thank you, Raphael. And it's very important that we put the link between health and transformation. So we have to continue this movement of transforming Barbados. We are at a stage in Barbados where we need to move forward and transform. So now I will go over to Shereika Mills, who is the Advocacy Coordinator with the Jamaica Youth Advocacy Network. Shereika, how can youth become more involved? You heard everyone speak. How can youth become more involved in this movement?
Well, firstly, thank you so much for having me. And I'm so happy to be here and to be included in this discussion, because in Jamaica, we have a serious public health issue as it relates to non-communicable diseases. 1 in 3 Jamaicans have hypertension and 1 in 8 Jamaicans have diabetes. And so we have to look at the risk factors, what is causing this to be an issue, some solutions, and then of course to include young people in the discussion, because as we know, these eating habits and health patterns start in youth and result in these non-communicable diseases. But then also, as Nicole was mentioning earlier, young people and children are becoming more affected by this issue. And so I think as youth advocates, we have to ask, how can we get young people involved? Not just how can they get themselves involved, because also a huge part of this issue will be awareness raising and capacity building with young people to even understand what is going on. You know, we really don't have nutrition education in the way that we would want it in our schools. And so it really starts there in terms of building awareness among young people of good eating habits and good health and nutrition, and getting them involved in advocacy around the issue, since it's something that affects them. And I think also a huge part of it will be having policies in schools that encourage good eating and good health practices. And also, I think it's important to note that in Barbados and in Jamaica, we have draft school nutrition and wellness policies that have not yet been finalized and implemented. And that's something that will be really important to have healthy eating in schools. I know in Jamaica, 3/4 of students get lunch at school every single day. And so that will be an important environment to encourage healthy eating. And so that is how we can get young people more involved.
Yes, Shereika, thank you so much. Just remember, we will get back to you right after the short commercial break, but just remember you can call in at 228-5562, and you can send your WhatsApp in as well to 228-5562 as well. And just remember, we have a poll coming your way very, very shortly. You can message this number 832-6775 to participate in the poll. So we're going to go to a short commercial break and come right back to you, Shereika. Hello and welcome back to a special edition of CBC Presents as we commemorate World Obesity Day 2022. World Obesity Day this year will be commemorated on Friday, March 4th, this coming Friday. And we would like to welcome none other, a special guest, Dr. Kia Lewis. Welcome. You were stuck in traffic, Kia.
Yeah.
How are you doing?
Hi, Taahir. It's always a privilege to be here. I'm great. I'm great.
Let me publicly commend you for the job you've been doing over the past 2.5 years. Please keep it up. So we're gonna jump straight into it. Everyone discussed the importance of healthy lifestyles, the link with transformation as well. But everyone touched on policy as well. Why is the implementation of a school nutrition policy, Kia, so important?
Policy, I like to tell people, people like to do things on their own will. So you say you can give people education and they'll make decisions. But public health policy is so important. And I think what has shown that more than anything else is COVID. So we know that when COVID first came around, everybody, people weren't wearing masks. Everybody didn't have the hand sanitizer, even though they knew that's what they were supposed to do. You know what made a difference, Taahir, and what I think saved us a lot? Policy. When people said, okay, we've got to get serious about this. This is an emergency. We need to put measures in place. We need law, right? And that's when the business owner said, all right, we have to put, the alcohol at the door. We have to do our temperature checks. And we have to make sure people are wearing masks or there are going to be consequences. Similarly, when you're dealing with a public health issue like obesity, the issues that we're having with NCDs like hypertension and diabetes, it's all right to educate the public, but then you need policy. And a school health policy, school nutrition policy is so important because this is where our children spend a large amount of their time. This is where they get at least sometimes 2 to 3 of their meals. This is where they're exposed to most of their snacking. And the school is a very formative environment. So this is where they're not only learning about maths and English, but they're really learning about life. They're learning how to live. They're learning what is healthy. When my son comes home and he says, my teacher says, that's it. I can say what I want. But they believe in their teachers and they believe in what they see modeled before them at school. And so we are at the point in Barbados when we see what is happening that we have to really look and say, look, we got to make a change. We can't just say, all right, let people, let the food education teachers, I'm saying food education, but you know what I mean. Yeah. The home ec teachers have their part or do a little lesson here or there, but we need policy to protect our children. They're in that environment and we need for healthy things to be available for them. If the unhealthy things are more readily available, that's what they're going to choose, Taahir. So we need policy and we need it urgently.
Absolutely, and it is important. We dealt with the families, we painted the picture of what the health crisis is in Barbados, we've dealt with the families, we've gone into the schools, and policy is important for transformation to take place. Raphael says that every day at work. Well, yes. We have our first caller on the line. Hello and good night.
Good night.
Good night, how are you doing?
Not too bad. I want to make my little 2 cents in this matter. I believe that while we are concentrating on the sweets and thing of those things, we also need to look into people's genetical backgrounds. It's very important with the scientists and the doctors looking at people's genetical backgrounds about this thing. And we are trying to say sugar and these things are causing people to... I want to say this, I'm going to say it openly. I grew up a young man, I'm a full age. No sweets. I use black, I use brown sugar. That's every day. I eat a lot of sweet things every day, and I have no problems, no diabetes, nothing at all. I know a lot of people have the same problem. I think one of the problems we are facing is bad eating habits. Some people are eating at the time, bad eating habits, and mix everything. There are people who have different stomachs and different digestive systems. I like to tell you, doctors, I know that. Some people suffer from gastric systems and things, and that's the problem. And it's seen from the early days. I think the doctors and people should have more research into the genetical backgrounds of families before they come and say, because I don't believe that sugar fully are giving people these things. I stand by, I challenge the doctors, but that's only sugar
Absolutely.
And sweet things, yeah.
Absolutely, genetical backgrounds does play a role, but I'll ask Dr. Khatija or Dr. Kia, would you like to take this?
I just want to say one thing real quick.
Go ahead, Dr. Kia.
I want to say to people say, well, you need all this research. There's been tons of research. There's been tons of research looking at the role of genetics, and we know it's one risk factor. There's been tons of research looking at other lifestyle issues like how we're eating and how we're moving. We know that those are huge factors. And I want, if you remember nothing else on this program, parents, the genetics that you pass down, it is less important than the health habits that you pass down. I tell people all the time, because your grandmother or your mother was diabetic, it does not mean that you have to be diabetic. It's the way that you live your life. We see it in the office all the time. When you sit down and really investigate what is contributing to it, yes, genetics plays a role. But you can skip these things, or you can delay them significantly if your lifestyle is appropriate, if you're eating well and moving well. So I want people to understand, like I said before, the genetics that you are passing on to your children is out of your control. But believe me when I say it is less important than the health practices that you are passing down. That is what is going to make the major difference for them.
Thank you.
And that's what the research shows.
Absolutely. We have another call on the line. There's lots of calls tonight. Hello and good night.
Hi, good night.
Hi, good night. How are you doing?
Hi, yes. I'm just going on from what Keith Lewis would have said, where she would have shared about the policies. But how can the private sector now become more involved in combating our health crisis?
Oh, that's an excellent question. Nicole? Raphael? Raphael?
I can go ahead. Nicole, you go ahead. You go ahead, Nicole. I'll come after you.
I just want to say something short. Like, when they're drafting food and policies, we see the guidance of obesity sectors, both public, individuals, schools. Everybody is a part of the production of or the putting together of a policy. It's not just one group of people saying this is what we want. We all get the budget. So in those cases, we ask public sector, hey, are you willing to modify, reformulate some of your products, whether it's drinks, food, whatever it is that they're making? Are you into reformulate? Would you want somebody to do some reformulation? Are you willing to put less sugar or less sodium? Or are you have more? A company may have a product that may be water, sell a sugar sweetened beverage. Are you willing to do some more marketing on your water than willing to do marketing on your sugar sweetened beverage? So there's buy-in from everybody, and it's not a one person site, it's a one site thing. It's always, when you have a policy, it always goes through different steps, and there's a whole sector. It's not just public but also private sector. So manufacturers will have the opportunity to say how they would want to buy in, because at the end we can't force them. We cannot force manufacturers, or it wouldn't be efficient to try to force manufacturers to do things that they don't want to do, but it's to see what they are willing to do and try to work with those things in order to get policies that will actually work. Because policies don't have buy-in from everybody, will always have issues when they are launched.
Raphael?
Yeah, I want to piggyback on what Nicole has just said. Fantastic points. Because we're talking about behavior change here, ladies and gentlemen, behavior change has to be one of the most difficult things to realize, right? We're not just talking about the communication of information or announcing new changes. What we're talking about is changing behavior. The only way to change behavior effectively on this scale, on the national scale, is to have a whole of society approach. What Nicole just said is 100% true. We can't have the left hand saying one thing and the right hand saying another. As much as we want to make sure there's correct advocacy and that appropriate information is provided at all levels so people don't have information gaps that stop them from making better decisions, we do need all sectors, including the private sector, as Nicole just laid out, from the perspective of how they market and produce and present their products. I mean, even when it comes down to financing, there's initiatives that need financial support, and in those contexts, it does become very important to ensure that the private sector and all other sectors see how this directly affects them. Sort of like COVID. Nobody gets spared the impact of this. You talk to different employers, and they've navigated times over the last 2 years where staff members have been out ill because of COVID, or perhaps you're a primary contact and therefore you need to be in isolation. You have fewer persons available for the workforce. Let's take a step back almost. Let's zoom out and think about this nationally. What happens when, because of this crisis, we have a significantly diminished national workforce? Not just one employer or another, but we have a national crisis where persons are restricted, they're stymied in their ability to contribute effectively because of chronic non-communicable diseases. The word just wasn't coming out there, but yeah. So it needs to be clear to private sector. It needs to be clear to public sector. This is not a Ministry of Education issue. This is not a Ministry of Health issue. This is an all of society crisis. And because we're looking to change behavior, and influence what children are doing. We're looking to influence what parents and adults are doing. We want to influence what manufacturers of products are doing. We haven't talked about front of package labeling yet, but I know we're going to get to that. So we want to influence all of these various segments in society, and the only way to do that effectively is for us to bring everyone to the table. And let's look at all the different permutations of this. Let's look at how wide and broad the tentacles of this crisis really reach into our society, and why it needs to be red alert for everyone in every sector to play their part, including, as the caller said, and as Kia mentioned just now and Nicole did, including the private sector, such a critical and vital segment in our society.
Yes, thank you, Raphael, and thank you, Nicole. So we're going to go to a short commercial break, and we're going to be right back. Hello and welcome back to a special edition of CBC Presents as we commemorate World Obesity Day 2022. We have an exciting panel and even more exciting discussion going on. We have Dr. Kia Lewis, who's a healthy lifestyle advocate, Nicole Griffith, who's a public health nutritionist, Dr. Khatija Mangera, who's a family physician, Ms. Shereika Mills, all the way from Jamaica, who is a policy and advocacy coordinator for the Jamaica Youth Advocacy Network, and last but by no means least, Mr. Raphael Saul, who is the assistant director with the National Transformation Initiative. And I think we have our first results from our poll coming in. Yes, we do. So one of your questions we had, do you think a school nutrition policy is important? Yes, 100% yes. Everyone has voted yes, and it follows on from what Nicole and Raphael was saying. And everyone alluded to that fact. Question number 2 in the poll, should businesses be more responsible in their marketing of unhealthy foods to children? We have yes saying, 89% of persons saying yes, while 11% saying no. So these are some very, very enlightening figures coming in. Feels like election night in this special edition of CBC Presents. But right back to the discussion now. And you remember you can call us at 228-5562 or 228-5563. And I think we have a call on the line. Hello, good night.
Yeah, good night.
Hi, good night. How are you doing?
It's hard to talk about the eating healthy. But the truth is that they only exercise in their fingers. They need to get out there and exercise too.
Absolutely, I agree totally with you, sir. Dr. Mangera, talk about exercise and the importance of exercise.
It's a valid point, but I still would like to emphasize the fact that you can't outrun a bad diet. So if you have been doing all the exercise in the world and you're still eating badly, then the outcome is still going to be not ideal. So diet still is an important factor. But definitely, we are living more sedentary lifestyles. And with the pandemic over the past 2 years, that has definitely increased. And children are definitely not able to run and move around as much as they used to. Um, I mean, it was a protective measure to reduce the spread of COVID. But with schools reopening and us trying to continue to live in this pandemic, definitely we need to cut back on screen time. So the recommendation is no more than 1 to 2 hours a day. And there are actually apps out there that parents can install on their devices that allow the device to shut down after the amount of screen time has been reached. So that's definitely one thing I would recommend. And also getting children involved in extracurricular activities after school or on weekends would be another recommendation. But to say that exercise alone is the only way, it's the only solution, I would say diet still is a big contributing factor.
Yes, thank you for that. And going back to sports as well, playing sports, and that's what something COVID did. We saw more children being on their tablets, being on their iPads, but COVID brought them out the house. And we saw the introduction of hiking, for example, a lot of groups going to hiking and using that free space and that open time. And going on to the beach on a Saturday, you would now see people playing cricket again. I remember a few years ago, I went to the beach when I was younger, and no one was playing cricket. But now everyone is playing cricket on the beach and football again. But Shereika, I'm going to bring you in at this point. What initiatives do you think communities can bring in to help fight this crisis? Everybody needs to act.
So one really cool thing I actually heard about recently was a community food garden, and they would plant fruits and vegetables, and so everyone in the community could have access to that. And I thought that was really cool and a really creative way, to have more access to fruits and vegetables. But I think also, and a really good way to get communities involved, as Dr. Kia was saying, is to get schools involved. And because parents and children are such an integral part of schools, it's really easy to get communities in on everything that's happening. There is a school in almost every community. So every activity that happens at school can include the communities. And so we think the community food gardens and the school gardens in themselves, super important. But there are also clubs like Jamaica Moves in Schools. That's like a school exercise club. And we think the community can get involved in activities like that. And just general nutrition education drives, stuff like that can be really cool too. So those are ways, that the community can get involved.
Brilliant, brilliant. The Caribbean was built on a community, and we need to go back to community being at the heart of our development. But I think we have some WhatsApp messages coming in as well. And I like the engagement on the show thus far. The calls have been nice. The engagement has been really, really insightful so far. We have a few WhatsApps coming in. Questions. My experience as an adult, it's easy to talk healthy foods, but Barbados is a very expensive place to live and eat. I'm going to throw that question to the public health nutritionist, Nicole Griffith. And actually, the follow-up, the response, actually, I'm not trying to be negative, just keeping it real. We must make healthy foods affordable to everyone, not only on the supermarket shelves, looking attractive. Nicole Griffith, how will you tackle this, public health nutritionist?
This is one of the most common things I always tell you whenever you tell them about healthy. But the thing is that snack is like between 5 and so apple is like 50 to 75 cents. You have more nutrients. There's a more nutrient. It's way better for you than a snack that contains very high calories and no. So just starting there alone, we at the Stroke Foundation and the Childhood Obesity Campaign had done a food map where we looked at the snacks that you carry and the drinks that they would carry to school in comparison to alternatives, things like fruits and nuts, and when we compare it in cost, it always comes down to serving for the cost. In this case, the healthier was always the cheap or equal to the equivalent to the package option. And so for us, I think it's a misconception because we are accustomed to thinking how we must have a full chicken leg, which is a leg and thigh together with our food. Really and truly, you don't need a full leg and thigh. Occasionally in the first place, but we buy them as we could have been giving them in comparison to having a snack box, which is like $17. You got of chicken, some peas or some tuna or something like that, and have it with rice, or you can have it with some kind of potato or something like that at home, and you would have gotten more servings, which could have fed more families than if you had purchased one snack box. And you know full well in Barbados somebody's going to consume that entire snack box. So I think that it has to do with planning, and because in most cases most people are going to do so without planning what they are going to cook for the week or without knowing what they want. So we just go in and say, wait, I see like buying this, or wait, this look good, I will eat some lamb, boy, this week. Where I had planned out, well, maybe I want to have lamb on Sunday, or I want to have chicken on Sunday, and said, well, I'm going to purchase some chicken breast or something like that, and I put small cubes, and it's going to serve X amount of persons in my family, along with a small portion of vegetables. And yes, canned vegetables may not be the best option, but to me, it's a better option than consuming some high in carbohydrates, no nutrient value.
And if I can jump in here,
go ahead,
I keep coming back to school nutrition policies, and I think that this will also address some of the issues there. So a school nutrition policy doesn't just cover the school retail environment where students are actually purchasing food at school, but it also covers school meal programs for students, for poorer students who are also being provided meals that are free or that are subsidized. These meals usually have lots of sugar. We even heard that what was provided to students at the beginning of the pandemic was fast food. And so it also would cover every instance where schools are already providing students with food. We're saying, think about the food that you are already providing. You're already spending this money, and can it be a healthier option? What better thing can you provide for students to eat than fast food, than food with lots of sugar, with lots of salt? Just think of a healthier option to eat because you're already spending this money. So it's not just to cover a school retail environment, but also to protect students who are poorer, who are getting subsidized and free food at school from the food that's currently being provided for them.
Absolutely.
I also want to jump in there.
Sure, go ahead, Nicole.
I also want to jump in there and say we live in the Caribbean, and I don't want to speak for the entire of Barbados, but I know for sure one way you can get exercise and get some is by for a walk in the pasture with some dung, some grapes, some. There are so many fruits just growing well across Barbados. Maybe not in the urban areas because I'm not familiar to say that I can walk in the urban areas and do such. But I can tell you that there are so many places that you can walk around. You can take a drive to a restaurant, take a drive to the country and walk around, go on the beach, pick some secrets. And those are things that you can do. You decide to get to spend time with your family members. Also get some nutrition for free. So we just need to go back to where we were back then. And I know people always say that back then people didn't eat as well, but unhealthy food was not as accessible and available as it is now, as how it was back then. So I think we'll go where we were before.
Absolutely.
We had fun. Remember, we would get back to no cost for some of the things and getting some nutrients and some more exercise.
Absolutely. Thank you, Nicole. Thank you, Shereika. We have a call on the line. Hello and good night.
Hi, good night.
Hi, good night. How are you doing?
I'm good. You?
I am well.
I have a question. What do you think is preventing the government from implementing this policy? I heard that it was important, and I agree that it's very important. I want to know what do you think is preventing the government itself from implementing this policy?
Excellent question. Dr. Lewis?
I think only the government can answer that question because as we look across the region, it's a little embarrassing as Barbadians that many other countries across the region have successfully, I might say, implemented school nutrition policies and other policies as well. And so I think that as Barbadians, we know that there's a lot going on, on the political scene and otherwise. But I think as Barbadians, it's for us to ask our government just what you asked. Excellent question. What is preventing us? Know that we see the damaging effects of diet on our children, the poor diet that they're getting. What is really stopping us? And I can't say that there's a lot in the way. I know that there are things on the table. I know that there are things that are going, but in my opinion, it's going a little bit too slowly for the level of crisis that we have. And we have seen how quickly things can be implemented in the setting of COVID. Things happen really quickly. You would always have a new directive. And so I would hope that we value the health and the lives of our children enough to speed things along a bit. We see the importance of it. I think it's crystal clear. We said that 8 out of 10 persons in Barbados die from NCDs. And now we have statistics showing that 1 out of 3 of all of our children is either overweight or obese. And I believe that that's probably worsened throughout the pandemic. We will need the research to show it. But preliminary research shows that we've had some weight gain for sure during the pandemic. So to your question, what is stopping? I think that we can all echo that question and ask our government, hold our officials accountable to say, what is stopping us? There's really nothing that should stop us at this point.
Thank you, Kia. And there's nothing stopping us. We have to agitate. We have to make that change that we want to see. We're going to go to a short commercial break and we'll be wrapping up after the commercial break. Welcome back to a special edition of CBC Presents as we commemorate World Obesity Day 2022. We have a call on the line. Hello and good night.
Hello.
Hi, how are you doing, sir?
I want to make a comment and
Sure.
a question. I agree that transformation must have several indicators, especially at the level of the individuals and quality of life. I think that NCDs are big threats to that. So I'm asking if we have begun in Barbados to chart the road to transformation from policy, strategy, and action plans. And how are we going to partner with like WHO and regional countries to address NCDs not only at the preventive level, but also at the curative level? That's my question.
Thank you for the question. And absolutely, transformation has started to take place. We have Raphael, Saul representing the National Transformation Initiative, and they're doing an excellent job. And we have the many NGOs working, like the Heart and Stroke Foundation. They have the Coalition for Barbados Childhood Obesity Prevention Coalition, and they work with many of the international organizations to fight the pandemic that we have. We also have some WhatsApps coming through. What treatment options are available for obese persons in Barbados and the Caribbean whose healthy practices aren't effective to reach their goals? Dr. Mangera?
Hey, that's an excellent question. So, just in summary, if lifestyle measures haven't worked, and usually we give them like a 3 to 6 month trial, and the patient has actually stuck to the regime and be consistent, then the other options include things like pharmacotherapy, where we use various drugs to assist with weight loss. And then depending on the BMI, the more severe obesity patients may be candidates for bariatric surgery. But usually those will be for patients with BMIs of like 35 and up. Because it's not like a quick fix. There are consequences to bariatric surgery and lifetime consequences of having such a major surgery. So the other options will be drugs. There are multiple drugs. They of course have side effects, so you definitely need to consult with a physician before you choose your medication that is right for you. And the other option is bariatric surgery.
Yes, thank you, Khatija. And that is very, very important. We have many options that we can use. Unfortunately, we're coming to the end of the show, but we have one more poll result coming in. Okay, what topic would you like us to discuss at the next forum? We have a wide range of topics. We have transformation taking the lead at 29%, nutrition at 24%, sports and exercise 18%, wellness 18% as well, and health at 12%. I think we discussed policy very well tonight, so no one wants to hear more on policy. I think we discussed it really, really well tonight. But thank you, and we must thank You Report Barbados for assisting us with the polls and data. We must go forward with data to drive our development. Ladies and gentlemen, unfortunately, we're coming to the close, so we're going to have our final wrap-up from our panelists. We're going to start with Raphael. Saul.
Thanks so much, Taahir. First of all, let me commend you, the Heart and Stroke Foundation, the entire team for putting this event together. I believe that this panel is representative of the type of approach that we need. I mentioned it earlier. It is one where everyone puts their hand to the plow to hear. We need to see this as a national, a regional, a global crisis and mobilize the sort of resources, intentionality, creativity, ambassadors, financing, all of what we need in order to push our region, and let's narrow it down to our context, push our country in the direction that we want it to go. A lot of what we do at the National Transformation Initiative has to do with what are the things that people need to unlearn, what are the things that we need to teach them that are brand new, or perhaps what are some of the things that have been known for a long time but might have been shelved as irrelevant, and we now need to bring those things back on the table. This conversation tonight fits very neatly into that mold. There are many things that we've all grown up with that perhaps we need to unlearn. There are narratives that we've carried now into our adult lives that are not serving us in terms of our health and wellness that we need to put aside. There are new things that we need to expose ourselves to, good information perhaps. Take a course on Coursera through NTI. Expose yourself to some new facts and information about nutrition and healthy living for you and your family. Or additionally, perhaps there's some old-time things that Granny used to do, those good provision foods and so on that I know some people on the panel may have had for lunch.
Thank you, Raphael. Thank you, Raphael. We have to go over to Shereika now. We're going to go to Jamaica. The Caribbean must work together. Quickly, Shereika.
Yes, definitely. As you just said, the Caribbean needs to work together because, as we realize, it is a regional issue, and we have to see how we can learn from each other to fight this. And it's partnerships like this, and through Healthy Caribbean Youth and Healthy Caribbean Coalition and the Jamaica Youth Advocacy Network, and young people putting their voices in and also taking the lead, that will help this to be successful. So thank you for having me.
Thank you, Shereika. It was a pleasure having you, Dr. Khatija Mangera.
Yeah, so I just want to say start where you are with what you have. We don't expect you to make drastic changes, but identify like one or two short-term goals that you can work on as a family and set a timeline and make sure it's achievable, the SMART acronym, and then build on that incrementally.
Thank you. SMART acronym is very important. Nicole, Griffith, public health nutritionist. Your wrap up.
I just wanted to show their folks who are interested in nutrition and for their families. Always plan before you go to this room, before you go for anything or food for dinner. Make sure that you always put a list of what you intake or what you have an idea of what you want to make, so that you can have a list so that you don't budget. But always remember to read your labels. We don't have front of package labeling as yet, but hopefully we do. But until then, please read your levels of your sugar, and to make sure that you try to buy fiber, which is 5 grams, means that your food is high in fiber per serving. That's all I want to leave with you. That's one way to try to help your family, one, to budget and to eat healthy.
Thank you, Nicole. And last but by no means least, Dr. Kia Lewis. You're stuck in traffic, but you've joined us. We thank you. Your final words.
My final words, everybody needs to act. Corporate Barbados, we need you. We need you to finance programs. We need you to come up with initiatives to support what we are doing. Government, we need you. We need policy. Our children are suffering. We need it now. Families, we need you. We need you to set the infrastructure that we can have healthy families and healthy children. Each and every person, we need you to play your part. We need each of you viewers to pressure government, to put pressure on Corporate Barbados, to say something to your boss, to say something to the community programs that you have, your church, your school. Say something. If it is on your heart like it is on ours, say something. Push, advocate. Everybody needs to act.
Everybody needs to act. Ladies and gentlemen, it was a pleasure. Thank you so very, very much. It was definitely an engaging discussion, an insightful one. I hope you enjoyed it. We must thank Dr. Kia Lewis, Healthy Lifestyle Advocate, Ms. Nicole Griffith, Public Health Nutritionist, Dr. Khatija Mangera, who's a family physician, Shakira Mills, the Policy and Advocacy Coordinator with the Jamaica Youth Advocacy Network, Raphael Saul from the National Transformation Initiative, and me as your host, Taahir Bulbulia. Just remember, World Obesity Day is commemorated on Friday, 4th of March, this coming Friday. And we have lots of activities in store. You can follow us on Instagram at Heart and Stroke Foundation, and you can follow us on Facebook where you can see lots of our activities and you can come and participate. Everybody needs to act. We heard about policy. We heard about what families can do to better the health and the nutrition that we have in Barbados. We heard on what communities can do, and everybody needs to act. Ladies and gentlemen, it has been my pleasure. We definitely have lots in store over the next 3 days, and it will be exciting, it will be engaging, and we must thank you. We must also thank You Report Barbados for providing us with the polls, and we must thank every one of you for watching, and we definitely look forward to seeing you next time on CBC Presents. And ladies and gentlemen, good night and God bless. It's been my pleasure. Taahir Bulbulia out.